Welcome to our doctor's edition. Every Tuesday at 7 p.m., we really want to introduce CBD to medical professionals. We have our medical advisory board, which includes naturopaths, they include MDs, nurses, holistic healers, chiropractors, pharmacists, dentists. So we really are excited to introduce our newest member that you heard from this evening. And what we do is that we really help other professionals to understand how CBD works in the body. We also help them to get past those negative stigmas that we all may have had about cannabis, myself included. And we really help them to understand how our products are different from other products in the marketplace. So I am an obstetrician gynecologist. My name is Dr. Rita McGuire. I'm an OB-GYN of over 30 years. I attended Wayne State School of Medicine, completed my residency right here in Chicago at Cook County. It's called Stroger Hospital now. I'm CEO of RJM Wellness and Rip Rita Fitness. I'm also a global women's health and wellness speaker. I'm part owner of a gym, and that's where I am now. Really helping men and women understand that wellness is key and using our products to help to assist with so many challenges in lots of our patients' lives. I'm also a member for Doctors for Cannabis Regulation. I'm a certifying physician for the medical marijuana program here in the state of Illinois, as well as one of the co-founders and chief medical officer for Wakana for Life. So yes, healthcare professionals need to understand what cannabis is, how it works, and the difference between medical marijuana, recreational marijuana, and CBD. So nurses, doctors, we talked about, we're even looking for veterinarians, right? Because we know our pets, some of our pets, many of our pets need the benefits that CBD even offers us humans. So our colleague, Dr. Sanjay Gupta, in 2009, said no to cannabis. He said, absolutely, there's no medicinal benefits to this plant. But it was in 2014 where he had to make a public apology. He said that we have been systematically misled about this plant. It wasn't until he traveled the world. He spoke to other healthcare professionals in Europe. He spoke to patients all over the world. He spoke to scientists. He spoke to experts that really help him understand that cannabis is one of the oldest medicines around. In fact, in the 30s, pharmaceutical companies like Park Davis, Eli Lilly, Pfizer, you know the names, they use cannabis plant medicine for over 100 different ailments. So yes, cannabis absolutely can be another tool in the toolbox, as I tell my patients, another tool in the toolbox to assist with so many conditions. So cannabis, the family, has two species. Marijuana, that's the one on the right that gives you the high, the euphoria, the paranoia, and maybe even the munchies. And then on the left is the species of hemp. And that's where all of our products are sourced from. Hemp gives you the health without the high. So the difference between marijuana and hemp is the percentage of THC, that's the substance that gives you the high, and CBD. See, in marijuana, the percentage of THC is 20%, can be as high as 20% or more. And the levels or percentage of CBD is low. Well, the opposite of true of hemp. CBD is high percentage and THC is 0.3% or less. So that's why we always relate to hemp as giving us the health without the high, because we don't want to get high, we want to get healthy. And there is a part of the cannabis plant, which is the hemp species, that does that. Hemp also affords us industrial uses. You know, they're making homes from hempcrete. They're making Automobiles, like the very first Model T Ford, was constructed from hemp. The very first Bible was constructed on paper made from hemp. The gasoline that Model T Ford ran on was constructed from hemp. So there's not only medicinal benefits to hemp, but there are industrial uses as well. So marijuana has high levels of THC, or delta 9 tetrahydrocannabinol. Yes, that's a long word. You don't have to remember it. But as healthcare professionals, we should really understand that there's a part of the plant that gives us the health benefits without the high, and that's hemp, because of its low levels of THC. And again, by definition, it is defined as containing 0.3% or less. There's also a difference in the way the plant looks. You see, marijuana has a very short, very fatter. It resembles a bush with more leaves and buds surrounding the plant's body. And hemp is very tall. It can grow as high as 20 feet. And the leaves are bunched near the top of the stem. But the main thing that I want you to understand is that marijuana does have psychoactive side effects, and hemp has no psychoactive side effects. And hemp is legal under the 2018 Farm Bill. In 2018, former President Trump passed an agricultural bill that now removes hemp from being a Schedule I drug. Yeah, hemp was right there with other very harmful drugs like LSD and cocaine. And now it is legal to consume, cultivate, and to sell in all 50 states. So Schedule I drugs are drugs that have no medicinal benefits. They have a very high profile for addiction, and there is a very high safety concern with Schedule I drugs. So hemp is no longer a Schedule I drug. Now, the FDA has only approved one CBD prescription. It's called Epidiolex. Epidiolex is used for children to treat seizures. If they have Lennox-Gastaut syndrome, Dravet syndrome, tuberous sclerosis complex. But what's interesting about this CBD approved prescription is that it costs $3,500. Now, of course, it's synthetic. It's taking the plant and building on it and using some synthetic byproducts. But just know that Epidiolex is the only and first FDA-approved prescription that is CBD. Whereas other FDA-approved medications like Syndros, these are THC medications. So these medications are used in the US. They're used for patients who have AIDS, who have a loss of appetite. These medications also are $1,400, $1,500. Marinol is another THC-based medication used for those who have extreme pain, debilitating pain, multiple sclerosis, and even metastasis to the bone if they have cancer. Sesamet is another THC-based, FDA-approved. These are all FDA-approved in the United States. Very expensive, but they do give your patients a high. Sativex, now this one is approved in the UK. It's a 1-to-1, delta 9 to CBD. Soon you'll probably see this medication approved in the US. But just know that our patients are sick and tired of the side effects of medications they're on. So many patients are looking to use CBD, and they're looking for their healthcare providers to really help them understand not only how it works in the body, but which product is the best product. There's so many products out there. There are products at the gas station. There are products at the smoke shop. There are products made in basements, you know. But you have to know as a healthcare provider, and even if you're not a healthcare provider on the line, that not all CBD is made equally. Let me say that again. Not all CBD is made equally. There are a lot of products out there that are not tested. You don't know what type of soil it's been cultivated on. Is it organic? Does it have pesticides and heavy metals? And when we're dealing with our patients who have immunocompromised conditions, we absolutely don't want to give them something that has these harmful chemicals. And these are some of the top reasons our patients are looking to use CBD: for relaxation, for stress, anxiety relief, to improve their sleep, to relieve muscle pain, to relieve chronic pain. I can't tell you how many patients are on opioids that have chronic pain. Opioids should not be used in anyone that has chronic pain. Those opioids and heavy drugs are only used for a short term coming out of surgery. But outside of that, there is absolutely no role for using those medications. They cause addiction. Addictions can lead to death. CBD is also used for migraines, offsetting nausea and vomiting. Lots of oncologists are recommending CBD to their patients for nausea and vomiting when they're on chemotherapy. Menstrual relief. I use a lot of CBD topical cream for those women who have menstrual cramps, using it topically and ingesting it internally. Treating seizures and even sexual enhancement. When we look at who's using CBD, we see the percentages are increasing each and every year. Even in the millennials, they're utilizing CBD more because they understand that they don't have to use marijuana in order to assist them with their anxiety or to assist them with their ADHD or whatever challenge that they're dealing with. Same with baby boomers, right? We are loving CBD. Once we understand that there's a part of the plant that doesn't give us a high, we're absolutely open to utilizing these products to assist with our challenges. So CBD, or cannabidiol, is the #1 compound in hemp. It has many benefits medicinally. In fact, there's 20,000 peer-reviewed articles that talk about its antibacterial effects, the fact that it inhibits cancer cell growth, it's neuroprotective, it promotes bone growth, it reduces seizures and aids in convulsions, it suppresses muscle spasms in those who have multiple sclerosis, it helps with anxiety, depression, even schizophrenia. There are many studies that show how CBD can even be a vasorelaxant. It can come in and improve blood flow to those who have hypertension, those who have erectile dysfunction, helps to reduce inflammation in the pancreas for those who have diabetes. It helps to reduce small intestinal contractions in those who have ulcerative colitis and Crohn's disease. I mean, I can go on and on and on, but the literature really backs up the fact that CBD has many medicinal benefits. There are other cannabinoids that the plant produces, like CBG and CBC and delta-8 THC and delta-9 THC and THCV. They all synergistically work on the body on a cellular level to put our body into balance. And so when we look at the plant, there's over 180 what we call phytocannabinoids. The #1 phytocannabinoid in hemp is CBD, or cannabidiol. But guess what? Our body also produces cannabinoids. They're called endocannabinoids. They're endogenously manufactured internally by the body. The two main endogenous cannabinoids are anandamide and 2-AG. See, anandamide and 2-AG are found in high levels of breast milk. That's why those breastfed babies are so happy, right? They're consuming endogenous cannabinoids that their mom is producing. Anandamide and 2-AG also help to reduce anxiety and inflammation. So we're calm, we're in less pain. But when our body fails to produce these endocannabinoids, our body fails to produce them because of the stress we're under, the air we're breathing, the water we're drinking, the food we're consuming, all of these internal and external factors cause our endogenous cannabinoids to be reduced or deficient. That is why everyone that you know, every patient, every family member, every friend needs CBD. The way it works in the body is through the endocannabinoid system. It's a science that was discovered when I was in medical school in the early 1990s at Wayne State School of Medicine. But the sad thing about it, I wasn't taught anything about the endocannabinoid system in medical school. See, this system is the most vital regulatory system that exists. It functions by modulating and regulating so many different physiological functions, like our metabolism, our blood pressure, our heart rate, our blood sugar, our sleep-wake cycle, our ability to maintain a healthy weight and to lose weight. It helps to address those autoimmune conditions like lupus and fibromyalgia, those symptoms that those folks get with pain and inflammation. It happens through two main receptors, CB1 and CB2. These receptors are found throughout the entire body. So you can see this diagram here. These receptors are found from the head to the toe, right? In our heart, our lungs, our liver, our kidney, our spleen, our skin, our stomach, our teeth. All of these receptors, CB1 and CB2, they bind to CBD, they bind to cannabis when we consume it. There are receptors on our skin, so when we use CBD topically, those receptors on the skin put whatever's out of balance on the skin back in balance, be it psoriasis or eczema or acne, right? So this is the science behind how cannabis works in the body. Now, there are many patients that are on medications, right? This is why so many patients are looking to use CBD. They're looking to use CBD because they've heard that it can be a tool in the toolbox. It can potentially help them reduce some of the medication they're on. It can potentially help them to come off of some of the medications. But as healthcare providers, we have to understand how CBD is metabolized. It's metabolized in the kidney, in the liver, by a pathway called CYP450. Now, a lot of drugs are metabolized in the liver through the CYP450 pathway. So that's why we have to understand that when we utilize CBD, if patients are on Coumadin or warfarin, for example, it could cause that Coumadin or warfarin to work or potentiate the effects. So it can prolong a patient's INR. Doesn't mean a patient can't take CBD if they're on a medication that is metabolized to the liver. It just means as healthcare providers that we have to monitor those levels of INRs, or we have to monitor the levels of theophylline or some of the other medications that our patients may be on. Another question our patients want to know, will the CBD show up in a drug screen? Many of our patients are still getting random drug testing. The answer is that there are different forms of utilizing CBD. Now, the topical form will not show up on a random drug screen. They're very, very safe to utilize CBD topically without having a positive urine drug screen. But there is a potential of showing up, a positive urine drug screen, showing up in someone who's using a full spectrum product. A full spectrum product is a product that has the legal limit of THC, which is 0.3% or less. That's what we call our full spectrum. It uses the whole plant, the terpenes, the cannabinoids, right? It's using the whole plant and the legal limit of THC. Now, they did a study where dosing around 1,000 to 2,000 milligrams a day could have an 11 to 23% chance of showing up in a drug test. Now, that's a lot of CBD. Most people do not take anywhere near 1,000 or 2,000 milligrams of CBD. But just to be super clear, I would recommend that those patients who have random drug screens utilize our broad spectrum product that contains less than 0.0% of THC. So the combination of the broad spectrum along with the topicals are very safe for those patients who have urine drug screens. Another thing is that really educate your patient that a point of care urine drug testing that is purchased at CVS or Walgreens, those are not very sensitive or specific tests. And when a patient utilizes those sort of tests, they can't pick up if it's CBD or THC. It just picks up that there's a cannabinoid there, and it may come out, many times it comes out positive. So I highly recommend that your patients go to LabCorp. LabCorp has a very sensitive, specific test that gives the employer a ratio so it can detect if that patient is taking CBD or if that patient is using marijuana. There's 5 things that you should know, that your patients should know before buying a CBD product. And this is why we recommend our Wakana products, because we understand the importance of the way the hemp is cultivated. The hemp is cultivated in organic soil. It's free from mold, mildew, heavy metals, pesticides. Our CBD is extracted through a very clean extraction method. So the biomass, the plant, it uses a supercritical CO2 extraction process, very clean, doesn't leave any residual solvents behind. And all of our products require third-party testing. So all of our products come with a certificate of analysis to ensure your patients, to ensure you and others that these products are not only effective and safe, but they are sourced from the hemp plant. They're not sourced from the marijuana plant. They have the legal limit of THC. So you have to choose Wakana, which is a brand that you can stand behind. Our products, choose Wakana. So supercritical CO2 extraction method is the cleanest way. There's other extraction methods like butane and propane and alcohol and water, but CO2 extraction process is a little bit more expensive, but is the cleanest way. There's different forms of ways of consuming CBD. Your patient can use a tincture under the tongue. They can use a vape pen. They can use a water soluble. They can use an edible. They can eat a gummy or use a spice or a butter. We have capsules. They can swallow it. Some patients don't like using oils and tinctures under their tongue. And then, of course, there are topicals. So when we look at utilizing CBD, we never, ever want to make any claims. Making claims like, oh, if you take the CBD, your diabetes will go away. No, no, no. What the literature and research has shown is that CBD can really assist with the symptoms due to so many challenges that our patients have. You know, challenges and symptoms of diabetes are many. You know, just alone the neuropathy, the pain that our patients have in nerve endings, the topicals have worked extremely well, right? Helping them to reduce inflammatory process in the pancreas, helping those beta cells to really function more properly, and of course, really driving in their diet is really what is helping patients even with diabetes. So start low and go slow. You don't need a lot of CBD to really help to assist with symptoms that they may have due to diabetes. 2.5 to 20 milligrams per day. This was a study done at the Mayo Clinic that showed more is not better. Even cholesterol lowering, you know, really starting low and going slow, incorporating lifestyle modifications, diet and exercise as always, but really helping with some of the symptoms that we see in those who have cholesterol. CBD helps to reduce the plaque buildup by reducing the inflammatory process as well. So these are studies, and as healthcare professionals, I wanted to see the studies. Now that CBD or hemp is legalized in all 50 states, we're now able to see studies done on humans, right? And not just on piglets and mice. A lot of institutions like UC San Diego's, they're doing studies on CBD and ADHD. They're doing CBD and looking at eating disorders, as well as anxiety and depression and schizophrenia. There's just a lot of studies that are now going forth that it is now legal. So this study is looking at CBD use in difficult to treat pain. You know, that's the hardest thing that we have to do in medicine is treat pain. And we're looking at, you know, reducing the use of those THC sort of FDA approved medications like Sesame and Marinol. We're also looking at reducing Tylenol and ibuprofen. Many of our patients take that as well. That causes long-term kidney and liver damage. But utilizing CBD, even in anxiety disorders, we understand that CBD helps to release more serotonin and dopamine. It works in the central nervous system. It works on those pathways to even improve mood. Therapeutic use in cancer treatment, in the nausea, in the vomiting, in the inability to have an appetite. CBD has been very, very seriously looked at as a therapeutic potential for cancer treatment. Diverticulitis, we talked about how CBD reduces the contractions of the intestinal tract, reduces inflammation. It helps to put even the intestinal tract back in balance so that there is a reduction in pain. When we look at other GI disorders like GERD and reflux, Crohn's disease, lots and lots of studies that you can look through PubMed, as this is a non-psychoactive product that we can absolutely use to help prevent and even treat some of the symptoms that we see in GI disorders. So this is just an example of what I would recommend as a healthcare professional for that patient who has diverticulitis. What we call here is layering. That's not just using one product, but using 2 to 3 products so that that CBD is in a steady state in the bloodstream at all times, right? Our gummies kick in about 30 minutes to almost 2 hours. So as you take that gummy and you're looking for the relief, you've got that pain cream that you're using topically that's going to give you pretty much instant relief within 1 to 5 minutes topically in the area that's causing discomfort, and then also utilizing the tincture underneath the tongue. It takes about 15 to 20 minutes to get in the bloodstream. So as you can see, as one is kicking in, the other one has already started to work so that you have that steady state of relief 24/7. So I'm going to go through some of our other products here at Wakana. Again, all of our products come with a third-party validation, a certificate of analysis. The FDA does not approve of any of these statements, stating that we can't make claims that these products are not intended to diagnose, treat, cure, or prevent any disease. All information here is not meant as a substitute or an alternative for your healthcare practitioner. Right? So if you're under a doctor's care, if you're on medication, if you're a healthcare professional, understand that we really want our patients to be open. We want to have an open dialogue with them about CBD, and we want to give them a safe and effective product. So we have smokables, we have tinctures, we have topicals, we have edibles, we have hair care, we have sexual health, we have essential oils. We even had to pivot when the pandemic hit with our sanitizer, with our Royal Defense to keep our home and our offices safe. This is an example of our certificate of analysis. They're very easy to read. They're one-pagers, right? Pass or fail. Of course, all of our products pass. We don't release anything to the marketplace without doing this third-party validation to ensure that the potency of the product is on point, that the product has less than 0.3% of THC if it's a full spectrum product, and to ensure that the product is free from mold, mildew, heavy metals, pesticides, residual solvents. All of those things could harm not only someone who's immunocompromised, someone who has cancer, someone who has AIDS, but even can harm a healthy person, right? No one has time to have any contaminants in their CBD. So our tinctures again come in our full spectrum, our power products, or our broad spectrum, our pure products. So we have a product line for those who have random drug screens, and we have a product line for those who do not have random drug screens. So just know that our tinctures are placed underneath the tongue. You hold it there for 60 seconds before you swallow to let those sublingual glands really absorb the CBD so they can get into the bloodstream and really start working. It takes about 15 to 20 minutes for tinctures to kick in. The Power Water Soluble is another product that you can put in water. You can put in your tea. You can put in anything that's liquid. Some folks don't like holding tinctures under their tongue for 60 seconds before they swallow. So we have a great line called our Water Soluble. We even have a more therapeutic product. That's our Hemp MD. Now, the other products are between 300 and 500 milligrams of CBD. Our Hemp MD is 900 milligrams of CBD. It's our most potent CBD tincture that really is reserved for those who have more serious challenges in their health. Our hemp-powered hair on the very far end is a great product for those who have alopecia. They have issues with thinning, with shedding. They have had maybe COVID and they've had a bout of hair loss. Maybe they have traction alopecia. They've been wearing braids and weaves and wigs. This is a product that can also be used under the tongue, or if they have random drug screens, it can be used topically in the area to help address those hair issues. The other benefits of our tincture, the other benefits of our Wakana products is that our products are very unique. Again, not all CBD is made equally. Our products have a proprietary formulation that really help to enhance the benefits that we spoke about earlier of CBD. We enhance our products with essential oils. We've enhanced our Hempranium 500 with black seed and turmeric. These are two essential oils that do some pretty amazing things for the body. See, black seed has been found in research to help rebuild the beta cells of the pancreas, to help improve blood sugar levels. Turmeric, anti-inflammatory, really helping to not only enhance emotional well-being, but very good for the heart as well. And then our carrier oils. We use MCT coconut and hemp seed oil to really help carry these essential oils and CBD into the cell. Our topicals are great because they offer local relief to those achy, sore joints and muscles. Our Extreme Power Pain Cream, I use every single night. Every single night. I work out 6 days a week. So you know I am using that Extreme Power Pain Cream. I personally like using it at night so that cream can really sit in and really activate and soothe those muscles. Our Dr. Rita's Rub, or our Power Liquid Relief. This is in a roller ball. It's a liquid, not a cream. I like using this during the day, just rolling it on those knees and shoulders that are sore. Just know that these are power products. They will not pass the blood-brain barrier. So if your patient has random drug screens, they too can use all of these power products. We have a serum for the face, reversing aging, addressing wrinkles, addressing skin conditions, some of the symptoms from psoriasis, eczema, and acne. Our Holy Glow serum, along with our moisturizer and mask, is an amazing product to really address those who have issues with their skin. Skin is the largest organ in our body. We want to protect our skin. So we also offer a Power Mango Body Cream. It's a body cream. You can use it all over your body, from your head to your toe, infused with 500 milligrams of CBD. I have patients that tell me that when they use the Power Mango Body Cream, it actually helps with their inflammation and pain as well, even though they're using it to keep their skin moisturized. We have other products like our Oud Glow Naked, doesn't contain CBD, but an amazing product to help to restore the skin. Our Lotus and our Hibiscus are two body creams that, yes, are infused with CBD. We have other products that really, really do address skin challenges, but also they're used for sexual enhancement as well. So these are some of the many benefits that these topical products have. Our edibles include our gummies, as well as our brew. We have a coffee. Well, it's not really a coffee, it's a brew. It's not Dunkin' Donuts, it's not Starbucks, but it is a holistic, organic way of getting coffee in for those coffee drinkers. So it's using white kidney bean. It's using green tea extract. It's not using the caffeine that makes your heart palpitate, but it's utilizing CBD along with organic herbs to not only give you energy, but help reduce your appetite, to help reduce your cravings. So we call it our flat belly brew. Our gummies come in our full spectrum, our broad spectrum, and we even have a Delta 8. Delta 8 is a little different from CBD. Delta 8 is for those who really need more of a potent gummy to help them address their challenges. So Delta 8 is for those who may have consumed Delta 9 in the past and really loves the effects of Delta 9, but without the high. So those are our gummies. Our sexual one, our King of the Jungle, is amazing for both men and women that are looking for a way to address their sexual dysfunction, their libido, right? Our King of the Jungle is a great gummy. Then we have our essential oils. Our essential oils really are great for those who are looking for products to address seasonal allergies. They're looking for products to address a reduction in viral and bacterial loads that can enter through the nose. We have our First Defense. That's this product over here on the far right. Our First Defense utilizes our essential oils along with CBD to help to address those foreigners from coming in through our nasal passages and utilizing that as a way to reduce bacterial viral loads and even those seasonal allergy symptoms. Our eucalyptus, our black seed, peppermint, frankincense, our lemon oil, tea tree, all of our organic essential oils that you can use topically, you can use in your diffuser, you can utilize some of them internally. Just follow the directions on many of our essential oils. Even as an insect repellent, I love using the peppermint to keep those bugs away in the summer. Our smokable products, they offer you a very, very fast result. Within 1 to 5 minutes of pulling on that CBD joint or that Delta 8 pre-roll or that Delta 8 vape or that CBD vape, whatever it is, the smokables work very quickly and they offer that relief within 1 to 5 minutes. I love these products because they really, when you pair them with the gummies, when you pair them with the tincture, you always have one that works super fast, and that's a smokable. Now, all of the smokables are power, so they would not be able to be utilized in your patients who have random drug screens. So you're able to reduce inflammation, you're able to reduce anxiety in a very, very quick manner. Our culinary products, our spices, our garlic fire, Flavor King, our chili lime, our butter, our culinary plus products, all of these products can help to enhance your recipes at home, but also give you the same benefits that we talked about CBD giving you on a cellular level. Our hair care, our Save Our Strand system infuses CBD in our shampoo, our moisturizing conditioner, our leave-in detangler, and our styling cream. We even have a product for men for their beards and scalp, as well as the hemp-powered hair that I talked about earlier. This is a great product for those who want to maintain the luster of their hair and for those who have some issues with hair thinning and hair loss as well. And then our Royal Defense. We have products, they're not infused with CBD, but these products are approved CDC products for those homes and offices to really address the COVID-19 virus. So our hand sanitizer, our hard surface. We even have a produce wash. I use it on my produce, right? I don't eat meat anymore, but some people use it to clean their chicken, their fish, etc. We also have masks. We have everything for you and those frontline workers to stay safe and healthy. Our sexual health is another big line of products. We understand that sex is very important in overall wellness, right? We all should understand that. We have our CBD lube for those women who have vaginal dryness due to menopause, low libido, low sexual comfort because of dryness. They can utilize the CBD lube. It is a power product, but it's topical. So for those patients who have random drug screens, they can still utilize that. And then we also have our King of the Jungle gummies, can be used by men and or women, as well as our Lotus, our hibiscus body creams to get you in the mood. These are the recommended uses. Start low, go slow. I can't say that enough. Start low, go slow. More is not better. So with the tinctures, 3 drops twice a day. With the gummies, starting with the 4th or a half, as needed. Increase it after 45 minutes or 2 hours. 1 to 3 pulls on the smokables. You don't want to smoke the entire smokable. Why? Well, if you smoke the entire smokable, that's way too much CBD at one time. You'll have a side effect. You may have nausea, vomiting. You may have extreme fatigue. You only need 1 to 3 pulls 3 times a day. The spices, about 1/4 teaspoon per serving. And then the hair care and sanitation as directed. So there's so many great choices. You cannot go wrong with any of our products. We are the crown jewel of CBD. I want to thank you for attending. Hopefully there are many healthcare providers on the line. If not, that's okay. If you're a lay person, please connect with the person that invited you on this call. If you have any questions, you can put them in the chat. My email is there, ritamd@wakana.com, ritamd@wakana.com. You can message me through my email. I do want to invite you to our 8 o'clock call. Our 8 o'clock call is our business overview, where you get to learn more about the opportunity. There's an opportunity for you to lock arms, and many healthcare professionals want to introduce this in their practice. They want to have these products in their practice as another tool in the toolbox for their patients. So that's all from me. If you have any questions, you can put it in the chat. And I am here at the gym, at one of my gyms here, so you can see the background. Class is over, and my clients were so happy that class is over. But if you have any questions, please put in the chat. Otherwise, we're going to get ready for our 8 o'clock call, which is in 8 minutes. Tavara says that he uses the pain cream at night on my feet and back. Yes, that pain cream you can even use during a migraine. You can put it there in the temporal area, in the occipital area, in the back of the neck. I'm telling you, these products are great and a great way to reduce your intake of Motrin or Aleve, ibuprofen, Tylenol. All of those products, yes, can have some pretty serious side effects using them long term. Are there any questions, Yakima? Do you see any in the chat?
No other questions.
Okay, wonderful. Well, this was great. I'm so glad you were able to join. This is really exciting whenever we have a new member of the Medical Advisory Board, always chiming in, always giving us some insight and input. And you can just let us know if you have any testimonials from your patients.
Okay.
At this time.
Oh, cool. Thank you. I do. I have actually a 90-year-old grandmother that has been using this pain cream for over 6 months now, and she loves it. She always says how she's able to pick up her knees now using this pain cream. So she swears by it, and a lot of my other clients, they love it. So I would recommend this pain cream to everybody.
You know what? That may sound really, really small, but that is really big. Like you said, for a 90-year-old, just to pick up their
Her
needs,
niece.
you know, just the quality of life that we could really help those that we know, those that we love with these products.
Yes.
Small things are big to 90-year-olds, 80-year-olds, 70-year-olds, 50-year-olds, 60-year-olds, whatever the age. These are just amazing products, and thank you for sharing that testimony. But it doesn't look like there's any other questions, so we will see everyone in 7 minutes. If you're a guest on the line, please connect with the person that invited you so you can get your products ordered. And if you have the opportunity, join us in 7 minutes on our business overview so you can hear about the opportunity as well. So good night, be well, be safe, and we'll see you soon.
Good
Thank you
night.
so much.
Thank you.